Hello, my name is Brian, and I'm a licensed massage therapist in the state of Georgia. In this video, I'm going to talk about carpal tunnel syndrome, or CTS for short. CTS is often misdiagnosed because other situations can mimic it, so if your symptoms led to a rapid diagnosis, you may want to get a second opinion. In one study I read, 50% of all surgeries to correct CTS were unsuccessful, and even when diagnosed correctly, 45% of the patients needlessly underwent surgery. The study also found that second surgeries were often performed with limited success, and even when initially successful, symptoms commonly returned in less than a year. A common theme in these studies is to prioritize non-surgical remedies first. One study sent 90 different scenarios to a panel of doctors. Of those 90, only 16 fit the necessary surgery category. The remainder of cases were deemed either inappropriate or optional for surgery. So let's talk about the symptoms. CTS sensations are often found in the palm, the thumb, the pointer finger, middle finger, and or half of your ring finger. Sensations might include burning or shooting pain, tingling like pins and needles, or occasional numbness. These are all telltale signs of nerve pain. Your hand may feel weak from atrophy, and pain is often worse at night and usually more severe in the dominant hand. Who is affected by CTS? Well, CTS is the 8th most common non-fatal injury, affecting 4 to 10 million Americans at any given time. Researchers theorize that poor ergonomics, repetitive motions, and or sustained loads on the fingers to be the cause. Complaints come from people who work with their hands, such as office workers, some musicians who use stringed instruments, bakers, manufacturers, assembly line workers, checkout clerks, people who clean for a living, and people using tools that vibrate like jackhammers, impact drivers, drills, etc. It is more common in women and Caucasians and those with square-shaped wrists. Pregnancy, wrist injuries, and rapid weight gain can also trigger CTS. Finally, some of us are just genetically prone to CTS. So what causes these symptoms? Essentially nerve compression. In true CTS, the median nerve passes through a valley made up of the wrist bones and under a bridge of ligament. This creates a tunnel where the tendons and nerves all pass through. When the tunnel gets constricted, the nerve can get squeezed, leading to the previously mentioned pain. There are a great number of other conditions which can mimic CTS. Here's a slide listing everything I could find that could cause CTS. It is a large list, so you can see how tricky a good diagnosis can be. The wrong diagnosis can lead to unnecessary surgery or lack of a remedy, so a thorough assessment should be sought. What exactly makes for a thorough assessment? Well, typically this would include an electrode diagnostic analysis of the electrical activity in your nerves, an assessment of hands, arms, shoulders, and neck to eliminate conditions and or find the root cause. Wrist and fingers are tested for sensations. Hand strength is assessed and considered. X-rays, ultrasound, and or MRIs can be used to rule out or confirm causes. 2 tests can also be employed, Phelan's test and Tinel's sign. These can quickly evaluate for possible carpal tunnel. So if your doctor used several of these assessments to arrive at your diagnosis, you should feel confident. However, if none or very few of these assessments were done, it would be prudent to have your physician reevaluate or get a second opinion. So now let's talk about the non-surgery treatment options. Immobilization of the wrists with splints is usually the first remedy. Putting the wrists into a neutral position creates the most space in the carpal tunnel. Occupational modifications to your work activities, such as more frequent breaks or frequent changes in tasks, and are creating a more ergonomic environment. These are all beneficial. Anti-inflammatory medications are sometimes used to reduce the inflammation, which in turn reduces the swelling and creates more space in the carpal tunnel. Corticosteroids might be used to dissolve some of the connective tissue. Now, dissolving tissue that holds your joints together is of concern, so you may want to consider this as a last resort. Yoga, low-level laser treatments, and even chiropractic work may have also been suggested. Last but not least is massage therapy. Manipulating, softening, and stretching muscles to free up an entrapped nerve, this is where massage therapy really excels. In summary, if you've been diagnosed with or suspect you have CTS, advocate for yourself to ensure a solid diagnosis. Speak with your doctor about trying all non-surgery treatments first. And lastly, remember that massage therapy by a skilled therapist is often very well suited to releasing nerve entrapment. If you found this video helpful, please visit my website. From there, you can like or subscribe to my Facebook page. Thank you.